Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival.
Welcome to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, entrepreneur, and coach. In today's episode, we're going to slow this down and make it practical. I'm going to walk you through 3 frameworks you can use to get clear on what you actually need, how to separate fear from facts, and how to start making aligned moves without making impulsive decisions or burning everything to the ground. I'll also share a few specific examples of how physicians pivot in real life so you can start seeing options where you may be seeing a wall. Before we get started, here's a quick check-in. If you're driving or walking, keep your eyes open, of course, but if you're in a place where you can pause for 10 seconds, take a breath and ask yourself, what has been taking more from me than it's been giving lately? Just notice what comes up. No fixing anything yet, just naming it. There comes a moment in every physician's career where something inside of you says, this isn't it. And that moment requires a decision. Sometimes that this isn't it shows up as dread on a Sunday afternoon before your next shift. Sometimes it's irritability with patients, staff, or your own family. Sometimes it's the sense that you're always behind, no matter how hard you work. Or it can be more subtle, like you're doing the right things, saying the right things, and getting the right results, but you don't feel present in your own life. And I want to name something important. Not everything that feels like burnout is the same thing. Burnout is often about depletion. Your body and mind are exhausted. You may still care, but you don't have the capacity. For example, you finish clinic and you feel like you've been hit by a truck, even on normal days. Moral injury is often about conflict. Being repeatedly asked to do things that violate your values or your clinical judgment. For example, you're pressured to move faster than what feels safe, to document a certain way, or to prioritize metrics over the patient in front of you. Misalignment is often about fit. Your current role no longer matches who you are. For example, you're capable, respected, and successful, but your workday is filled with tasks that don't use your strengths and don't reflect what matters to you anymore. When you understand which one you're dealing with, you stop treating your life like the problem and you start treating it like data. And that's where the decision point becomes clear, to choose yourself. And choosing yourself does not automatically mean quitting medicine. Sometimes it means renegotiating your schedule. Sometimes it means changing your clinical environment. Sometimes it means building a portfolio career, clinical plus something else. Sometimes it means leaving medicine, but we earn that conclusion through clarity, not panic. Now that sounds empowering, but in real life it's uncomfortable. It's uncertain, and you can feel like you're stepping away from everything you've worked for. Choosing yourself often means questioning the path you were on, letting go of expectations, and facing the unknown. And in medicine, that's especially hard because everything is structured. We're trained to follow a path, not to question it. But here's the shift. The moment you stop making decisions out of fear and start making them from clarity, everything changes. You begin to see options you didn't see before. You begin to think differently about your career, your time, and your life. And you realize you were never as limited as you thought. Clarity starts with honesty. So here's the first framework, the clarity triad. When you're trying to decide what to do next, look at 3 categories: energy, what drains you and what restores you during the workday, not just on vacation. Values, what you need to feel integrity and meaning. That could be quality of care, autonomy, mastery, family time, service, stability, or creativity. Whatever is true and authentic for you. Constraints. These are the real-world guardrails. Finances, visa or licensure issues, child care, health, geography, loan obligations, partnership needs. Most physicians only look at one category, usually the constraints, and then they call it realistic. But a plan that ignores energy and values isn't realistic either. It's just familiar. For example, if your energy is crushed by nights, your values include being present with your kids in the morning, and your constraints require keeping benefits, then the next step might be exploring day shift roles within the same system or a different specialty mix before you decide you need to leave medicine entirely. Next, what is draining you? What is energizing you? And if nothing changed in the next 3 years, how would you feel? Most people avoid that question because they're afraid of the answer. I know I was, but by answering these questions, you get more clarity, and that helps you move forward. But clarity doesn't come from overthinking. The next framework I like to share is a zoom in, zoom out framework because physicians love all or nothing conclusions. Zoom out and ask yourself, what is the actual category of the problem? Is it a workload problem, a boundaries problem, a leadership problem, a fit problem, or a season of life problem? Then zoom in and ask, what is the smallest change that would create a meaningful shift in the next 30 days? Not a perfect plan, not the 5-year plan, a 30-day shift. Those examples could include dropping one committee commitment, setting a hard stop time for charting 3 days a week, having a direct conversation with your medical director about 2 non-negotiables, moving to a zero point 0.8 FTE for 1 year, or building a protected half day to explore a non-clinical interest. Those are not small in impact. They're just small enough to be doable. And it comes from movement. Framework number 3 is the decision ladder. When you feel stuck, you're usually trying to jump from I'm unhappy to I need the perfect answer. Instead, use the decision ladder. With that ladder, you need data. What are the facts of your daily experience? Your hours, your call schedule, your sleep schedule, your recovery time, conflict points, and administrative load. What are the patterns? What repeats? What consistently drains you? Or what energizes you? Options. Generate at least 10 possible moves. Experiments. Pick 1 to 2 low-risk tests for the next 30 to 90 days. Commit. Use what you've learned to make the next decision. For example, if your data is saying you're charting until midnight 4 nights a week, and the pattern is that you feel trapped because you can never catch up, one option might be leaving the job, but another option may be hiring a scribe, using templates, reducing your panel size, switching clinical sessions, or renegotiating inbox coverage. You could also delegate some tasks after review to ancillary staff. An experiment could be a 6-week documentation reset, protected admin time twice a week, plus a hard boundary on after-hours charting with clear metrics. Then you commit based on what actually changes. You don't need a dramatic exit. You need small, aligned decisions. Say no when something no longer fits. Exploring something new. Having one different conversation. That's how the change begins. Here are 3 real-world pivot examples so you can see exactly what it looks like. Example number 1. I thought I hated medicine. I actually hated unpredictability. One physician I worked with was in an acute care role with constant schedule changes, frequent last-minute add-ons, and a culture of just figure it out. On paper, the job looked great. Salary, respected group, solid benefits, but their nervous system lived on high alert. When we use the clarity triad, the biggest energy drain wasn't patience, it was unpredictability. Their values included excellence and presence, and their constraints included staying in the same city and maintaining income. The reframe was, I don't need to escape medicine. I need a role with predictable cadence. So their experiments were 1. Exploring outpatient roles with set clinic templates. 2. Informational interviews with physicians in occupational medicine and academic outpatient settings. 3. Renegotiating call frequency while they transitioned. Within months, they moved into a position with stable hours and fewer crisis interruptions, and their burnout symptoms dropped dramatically without leaving medicine. Example number 2. The problem wasn't my specialty, it was my boundaries. Another physician was convinced they needed a full career pivot. They were exhausted, resentful, and constantly behind. And when we mapped their week, we found something clear. They were functioning as the reliable one. They said yes to add-ons. They covered colleagues. They responded to messages instantly. And they carried work home every night. The reframe wasn't, I need a new career. The reframe was, I need a new relationship with my time. Their 30-day zoom-in changes were very specific. They stopped taking same-day add-ons after a certain time. They created 2 standard phrases for declining extra work. I'm at capacity this week, but I can revisit next month. And I can't take that on, but I can help you identify who owns it. They also blocked 30 minutes at the end of clinic for closing tasks so the work didn't spill into the evening. What happened next is important. Nothing collapsed. Some people were surprised, yes, but the system adjusted to those boundaries. And once they recovered bandwidth, they were able to evaluate their career from a regulated space, not a desperate one. They still made changes later, but they did it strategically, not reactively. Example number 3. You don't need to pick one identity. A third physician loved patient care, but felt flat and unchallenged by the repetitiveness of the role. Their fear story was, if I leave clinical work, I'm wasting my training. But the truth was, they wanted expansion, not escape. Using the decision ladder, they generated options that included teaching, quality improvement, informatics, coaching, writing, and advisory roles. Their first experiment was simple. 1 protected half day every other week dedicated to a structured project. Building a quality improvement initiative they cared about and presenting it internally. That created visibility, which led to an official committee role, which then opened a part-time leadership pathway. They didn't leave medicine. They redesigned the container. If you want to do this for yourself, here's a quick exercise. Set a timer for 5 minutes and write down 10 possible moves, even the ones you think are unrealistic. Change setting, change schedule, change scope, add a non-clinical lane, reduce my FTE, change to a different employer, take a sabbatical, anything. Then circle one that could be tested in the next 30 to 90 days without compromising your life. Your job is not to solve everything today. Your job is to take one step that creates new information. Let me give you a simple scenario. A physician who keeps saying yes, more shifts, more responsibilities, more expectations, until one day they don't. They say no, and nothing breaks. That's the moment everything starts to shift. Let's talk about fear versus truth. Fear says, I'll lose everything. The truth says, you're reallocating. Fear says, it's too late. Truth says, physicians pivot all the time. I'm an example of it. And there's a lot more examples you'll see throughout this podcast. Fear says, I don't know how, but the truth says that's a solvable problem. And here's a tool you can use in real time when fear gets loud: the fact filter. Ask yourself, facts. What do I know to be true right now? Not predicted and not imagined. A, assumptions. What am I assuming will happen? C, choices. What are my actual choices, even if I don't like them? T, trade-offs. What am I willing to trade and what am I not willing to trade? A few more reframes that come up a lot are fear. If I step back, I'm failing. Truth. Stepping back can be a strategic reset. Fear. If I change paths, I'm starting over. The truth is, you're transferring skills, clinical judgment, leadership under pressure, communication, systems thinking. Fear. I should be grateful. Truth. Gratitude and dissatisfaction can exist at the same time, and both can be true. This doesn't mean making dramatic changes overnight. It means being honest with yourself about what you want, what's working, and what isn't. Because once you start asking better questions, you start creating better options. If you're in that space where you know something needs to change, but you don't yet have clarity, that's exactly where most physicians pause. And that's where structured guidance matters. If you're exploring what else is possible, the Career Pathways Intensive is your next step. And if you're ready to move from clarity to decision, the Career Pivot Intensive is here for that next level. You don't have to figure this out alone. Until next time.
Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.